Hi, my name is Lisa Marcos, and I'm the MCU nurse manager. The MCU was chosen to be the pilot floor for the virtual nursing and virtual safety companion project. And we've had this project implemented since the end of February, beginning of March, on the floor. It encompasses all 35 private patient rooms and has in each room a camera as well as a flat screen for which the virtual nurse and the safety companion is able to speak directly to the patient. So when the patients are admitted, we tell them about the program and we encourage them to participate. The virtual nurse rounds on the patient approximately every 4 hours, and the virtual safety companion is used mainly to help us watch patients that maybe need that extra little bit of watching due to the fact that they might be a fall risk, a little bit confused but redirectable, and need to be reminded to get into bed and stay in bed. Or they could just be one of those individuals that needs that little bit of help. Sometimes they tend to have difficulty moving and reaching their call bell or other items that they might need. So the virtual safety companion is able to help monitor those patients for their safety, and they contact us to let us know if those patients need additional assistance. So our nurses enjoy having the virtual safety companion be that extra set of eyes. As far as the virtual nurse goes, our nurses are really enjoying the virtual nurse because the virtual nurse, whether it's a male or a female, that nurse assists with admissions and discharges, as well as patient teaching. We often give them lists of patients that need a little extra teaching throughout the week. Maybe it could be for diabetes or new diagnoses like heart failure. So they'll call and do that teaching with the patient. Also, when they're doing assessments, the nurses might need that extra set of eyes to do that 4-eye skin assessment. So the virtual nurse is able to assist with that too. And then on the MCU, as with all medical surgical units, we have many new graduate nurses. And sometimes they just want to have an extra set of ears to bounce a few ideas off of and just have that question answered that maybe they forgot to ask when they were out at the nursing station with the charge nurse, and they've thought of it now when they've left, and they just want that extra person to be a resource. So that's what we use our virtual nurse mainly for at this time, but we're always growing and expanding and looking for new innovative ways to include the virtual nurse into our everyday routine. So it's not extra work, it's just part of our work. It's an integration, it's a partnership, and we enjoy it. Most of the patients like the virtual nurse, and they find it really nice to have an extra person to speak with. So the virtual nurse sees the patient on their own schedule unless we request a different schedule. So, and then our nurses are also doing their hourly rounding in addition to what the virtual nurse does. So many of the patients who tend to be on the elderly age group are a little bit, by themselves. They want that extra person to talk to. They like the communication. So I'd say overall, a lot of patients like the virtual nurse. And some of them even feel more comfortable speaking to the virtual nurse than their bedside nurse because they just are. And the virtual nurse is there all the time, and they know it. It's just a comfort. Well, I believe the virtual nurse has helped decrease our fall risks and the actual falls that we have because they are watching, not 100% of the time, or I should say the safety companion's watching. But I do feel it's really helped with those patients, and we have seen a decrease in our falls. I believe it would be beneficial in the other units if the patients meet the criteria. If the patients are not redirectable, then it wouldn't be as beneficial. Or if patients are 100% alert and oriented, and if for one reason or another they just didn't want to have a virtual companion, or a virtual nurse, which we've found in a few of our younger generation, they do have the right to refuse, then it would not be as beneficial. But overall, I do see a great benefit to it.